Basically, holistic dentistry is concerning itself with the health and well-being of the whole body as it relates to the mouth and how the mouth relates to the whole body. So it's very important that we're aware of the materials that we're using and what we're drilling out of people's teeth and how to handle that. So heavy metals can cause or be related to quite a large number of symptoms in your body. They can change your emotional behaviour, you can become irritable, you can get insomnia, fatigue, lethargy, have mood swings. It might be that you're getting physical problems like digestive issues, muscle pain, lots of headaches, kidney disease. It can also be related to things like low blood sugar, faintness, nervous system disorders, numbness, tremors, pins and needles, and even lack of coordination. So all of these things can be caused by common materials used in dentistry. Many heavy metals, for example, like zinc, chromium and iron, they're essential in tiny amounts. But if those accumulate too much in your body, then they can actually poison you. And the most common heavy metals that are associated with poisoning and that most people would be familiar with are things like lead, mercury, arsenic and cadmium. So look, when we go to the dentist, we trust that they're going to do their job, that they're going to put materials in our mouth and fill our teeth, and we don't really give it a second thought as to what they're using, because surely those materials like medications have been given a seal of approval. So we can often, as a patient, take it on face value that these things are okay and it's all right to put them in our mouths. But the problem is that some of those materials and metals, when tested in clinical trials, have actually found not to be so safe. And that's important. I mean, surely we should be putting things in your body that are healthy and are going to be good for you. Look, the world we live in today is more toxic and polluted than ever before. We've got air pollution, food pollution, pollution of the waterways as well. And our bodies in the past weren't so stressed and exposed to toxins, and we didn't have the demands or encounter what we do now in our modern lifestyle. And look, today many of us are so toxic that we're constantly on the edge of chronic illness. And it could be that the materials used in your dental work are adding to your problems or even causing them. So what's a metal? Let's just go back a little bit and talk about how they work and what impact that might have on you. So a metal is an element or a chemical material that transfers electrons. Now that's an electrical current, and a metal allows electrical current to run through it really well. And some metals are better at this than others, and it makes them quite volatile in how they would interact with the tissues and the substances inside our body. So that ability for metals to transfer ions allows them to become bioactive or have greater reactivity in our cells. And those metals can change the chemistry of how the cell function to what we call dysfunction. So I want to thank everyone who's here live now, and if you're watching the replay, then thank you very much for giving your time. I'm Dr. Rachel Hall of Evolved Dental Healing, and tonight I'm talking about heavy metals, mercury and dental amalgam and the effect that those have on your health and well-being. So why am I talking about metals in dentistry? Well, it's pretty obvious that we actually use metals quite commonly as filling materials, and the most common one of those is a product called dental amalgam, or the silver fillings that you have in your teeth. Now, I commonly get asked if those are safe and if people need to do anything about them. Those silver fillings are 50% mercury, and that's mixed with other metals like silver, copper and tin. And mercury is a heavy metal, and it's amongst one of the most neurotoxic elements on Earth. Now, neurotoxic means it damages your brain and your nervous system. So it damages the nervous tissues in your brain, and it damages the nerves that send the signal around the rest of your body. So is there a safe exposure limit to mercury? Well, the answer is no. There's no safe level of mercury for the human body. This means it's harmful at all doses. In dentistry, the law states that any scraps of the filling material from an amalgam have to be treated like a toxic substance. They need to be disposed of as hazardous waste material. So no matter if those scraps or leftovers are from putting in a new filling or removing an old one, we are not allowed to throw them in the bin or wash them down the sink into the water supply. And you know what's really crazy? The only place that these fillings is considered safe is once they're implanted into a tooth in the human body. Now that makes no sense to me. You know, like, you get the product, it's hazardous, it needs to be disposed of properly. You've got leftovers, you've got bits that you've drilled out, they're hazardous. But somehow, once you've mixed all this silver and copper and mercury together, it's now safe, and we can put that in a human being and not worry about what it does. So what I was taught was that once you mix those metals together, that the mercury is bound within the filling and it doesn't come out, it doesn't go anywhere, and it's really inert. But if mercury is toxic, why haven't amalgam fillings been banned? You know, the problem is that the dental associations say it's not for them to dictate to the dentist what they do and don't use. So there's no guidelines around the legislation on what products we can and can't use. So they've even used the line that the mercury fillings are manufactured by the dentist because we're the ones responsible at the point of source of mixing the metals and the mercury together. So that makes us responsible for the product. And what makes matters even worse is that the American Dental Association actually owns 2 patents for dental amalgam containing mercury. So there's a bit of a mismatch that we're here creating healthy teeth, wanting to support people with their health and well-being, but we're actually using products and materials that could be harmful or adding to poor health. So today it's estimated that the use of mercury fillings has dropped by over about 50%, which is fantastic. And the reason behind that is because people want white, natural looking teeth. And so we're using newer products that we have around instead. However, in the US and in the UK, the insurance plans or the NHS will actually only pay the dentist to use amalgam. And that means that they're still being used quite readily in those countries. And many, many people believe that dentists don't use amalgam anymore, and that's not true. We're still training all our young dental students to use it, telling them that it's safe. And the reason behind that is that it's a material that it's affordable, it's quick, it's very easy to use, it's very forgiving as part of its techniques. It lasts a long time, so many dentists still like to use it as their #1 filling choice. Now, holistic dentists and other groups have been lobbying for a formal ban on the use of mercury fillings, or to have it classified as a more toxic type material. There's been many lawsuits around trying to get this to happen. And having it classified as more toxic would require additional restrictions and more stringent proof of its safety. So let's have a look at mercury in the fillings and what its health effects are. So I'm going to be talking more about dental amalgam and mercury tonight so that people can understand what's going on in their mouth and the implications of that to their health and well-being. So thank you for joining me live, and thank you for watching on the replay. If you're getting value from this, then please do share the video. Let's get this out to as many people. Give us some thumbs up and particularly some hearts, because Facebook liked that and it'll get out to more people's feeds. So we're talking about the health effects of mercury. So mercury from your fillings and from other exposures, it's not bound. So the mercury in your fillings is not bound with the other metals. It's constantly being released. Now this happens at a greater rate or more dramatically when you grind your teeth together, or you're chewing against anything hard. You're having acidic drinks, or you're having hot foods and hot beverages or liquids. Mercury vapor gets released, that gets breathed in, and it gets absorbed directly through the cheeks and the inside of your mouth. And it also goes to your lungs and then through into your bloodstream. The effect is much worse of mercury release from the fillings if you clench and grind your teeth and you've actually got mercury fillings grinding against each other. So dentists are taught and claim that that mercury is locked up within the filling material, that it's bound there and it does not leak. But science has proven this to be otherwise, and the mercury does leak out from the moment that filling's put into your tooth until way beyond your natural lifespan. In fact, That mercury is a toxin and it affects your brain and your nervous system. It damages your cardiovascular system and your immune system as well. So the mercury gets stored into fat cells once it goes into the body. And you're like, okay, well, fat doesn't do anything, but big deal. But guess what? Your brain is mostly fat. So your nerves are coated with fat. So along the nerve, there's like a little sheath, and that protects the nerve and makes it conductive, so the electrical signals don't go shooting off all around the place. It actually helps it travel down the nerve fibre, so they can send those signals. So because they're so high in fat, your brain and your nerves are essentially like mercury magnets or mercury sponges, where it just sucks it in and it binds into those cells. Now when mercury contacts the brain, the neurons, which are the nerve cells, break down and short circuit. These are the nerve cells that signal to your body and send information. And a really low level of mercury causes those brain fibres to shrink. Now your body is amazing. It's constantly designed to heal and repair itself. But if the damage or the ongoing attack or toxicity is ongoing, eventually your cells can't keep up. They're going to get worn out and fatigue sets in, and your body starts to break down with what we call cell disease. And this is happening in your brain, in your nervous system, and in the nerves throughout your body. Now the problem is that mercury toxicity doesn't cause one specific symptom or condition or a set of problems, where you've got 4 or 5 symptoms that you can pinpoint. The effects are really variable, and that makes it hard to detect and treat. So this mercury that's supposed to be locked in your teeth and never leave is spreading around the body. And that's been proven in studies that they've done on sheep, where they mix radioactive mercury into the amalgam fillings and place it into their teeth. Now those teeth were then, the sheep were tested, and there was little to no mercury in the blood or the urine, which are the standard tests to detect heavy metals. What they found is that they had high levels of mercury in their kidneys, as well as their liver, their brain, their stomach and their jawbone. So the mercury leaves your fillings and goes to the organs that have lots of fat. Your brain and your gut have a lot of fat. In fact, your gut is like a second brain. It's got a lot of nerve endings, and it controls your immune system. So that means people with mercury exposure often have immune problems, as well as other issues that I mentioned earlier. Mercury is a foreign body, and once it's in your system, it attaches to proteins, and it creates what are called metalloproteins, and they are then targeted by the immune system. So your immune system comes around, sees this metalloprotein, and it goes, that's bad, I've got to deal with that. But these metalloproteins are also linked to autoimmune illnesses, because the problem is that your mercury is combining to your body proteins, and your immune system sees them as foreign and does all it can to remove them. The trouble is that the mercury protein is so similar to your normal protein that your immune system gets mixed up, and it targets both the bad and the good proteins, and we have what we call an autoimmune condition, where the body is attacking itself. So where else do we get mercury exposure? Now, look, if you say to your dentist, what about these fillings? What about mercury? A lot of them are going to go, oh no, you're going to get more from eating a can of tuna, etc. Yes, we do get mercury from eating cans of tuna. We also get it in our food chain because it's contaminating our soil and our waterways. We're also going to be exposed to mercury in the air that we breathe and from environmental sources like industrial waste. But you'd have to be eating a lot of tuna every day to eat the equivalent in mercury that's being released from your fillings. So these industrial wastes, what's in our environment and our food, that adds to the toxic load that gets stored in your body. So pollution, I'm going to have a sneeze, just do excuse me, bless me. Thank you for watching live, and it is live, and hence the sneezing, and that won't be edited out. So the mercury in the environment adds to the toxic load stored in your body. Pollution from coal burning also releases mercury into the air. That falls in the rain, contaminates the water supplies and our soils, and gets taken up into the food chain. But one of the biggest polluters of the water supply is from dental office waste, from us drilling out mercury fillings. So we need to be looking at this as a profession and how we can minimise exposure. And we do have ways of doing that. There are what they call amalgam separators, and they capture and filter out the mercury that's coming through the suction unit, stores it, and then that can be disposed of safely. A lot of beauty products contain mercury as well, especially those from overseas or that you can buy off the internet now. So it's important to just be aware of all these other contaminants. So how can we stop mercury exposure? Well, the only way to stop it from your dental fillings is to have them safely removed. They can be replaced with a white resin bonded ceramic called composite, or with a full porcelain. Now, I don't want you to just rush out and see any dentist to get this done, because special care needs to be taken, because when you drill on that filling, it's actually releasing mercury into the air. So to lessen your mercury exposure, that dentist needs to be using safety protocols to ensure that you're looked after and you don't get an acute exposure during that time. So you need to use rubber dam, air filtration, negative ion generators, and provide a separate air supply through a nasal hood or mask. So we use special drill bits as well, and use respiration protection masks to protect ourselves and the team. So that's what you want to be looking for in a dentist if you're considering getting those fillings replaced. Drilling out the fillings releases a massive amount of mercury vapour and filling particles, which you will otherwise ingest and absorb and inhale if you don't have those safety protocol comes. I also recommend support with a nutritional and supplement program to help neutralise and capture the mercury that's coming out from being locked in those fatty areas due to the change in electrical balance in the body. So as we take fillings out of the teeth, it changes the electrical balance, and then that means that the stores of mercury come out to try and even that out. So as your fillings are replaced, the mercury and other metals redistribute and spread to the other parts, as I've said, to try and rebuild and rebalance that electrical charge. So we're always going to recommend, particularly if you're of poor health, is that you consult with a doctor who understands heavy metals and amalgam replacement prior to going ahead with treatment, and they can advise what's the best protocol and way to look after and support your body, and do a detoxification as well, so that that combined mercury that's in your body and in your system and safely remove it rather than getting reabsorbed. So heavy metals, dental amalgams contain mercury. Mercury is toxic, it damages your brain and your nervous system. It's also going to cause cellular damage. It can also affect your immune health and many, many other things, so your digestion, cardiovascular health, and so on. The other issue with mercury fillings is that they're bathed in saliva, and when you've got different metals in a salty solution, you actually have a battery. So those fillings are producing electrical currents in your mouth, and this is a phenomenon that we call oral galvanism. So if you've ever touched one of your metal fillings with a fork, you get that sort of zing and metallic taste in your mouth. Or if you get a bit of aluminium foil between the fillings, if you've got a wrapper off something. Now, when that happens, it's a bit like the metal boiling away from the surface of the filling, and you can actually taste that metal vapour that's getting released. Now, the flow of electrical current through the filling is greater than that that's produced by your nerves. It's a bit like having all these little batteries in your teeth. Now, this can cause pain and other symptoms like headaches. It can also affect the immune system. It can cause symptoms like insomnia, vertigo and memory loss. So it's quite serious. Now, remember, your brain is only a few centimetres away from your teeth. So that increased electrical activity, which is stronger than the current of our body, can actually have quite an impact. Now, once the fillings are removed, the reduction in oral galvanism or the electrical supply occurs immediately once it's been replaced. And this can often be seen as a miraculous recovery or a change in people's symptoms because that current has gone and the stress on the system has been removed. Thanks for joining us, Mark. Nice to see you here. Thank you for everyone who's here live. Thank you for everyone watching the replay. Give us a shout out, put your comments, say where you're from, say hello, ask questions, give us a thumbs up and some hearts, and share the video. Make sure we get lots of people seeing this. So getting those fillings out, it's important that the amalgam fillings are removed safely, so that the safety protocol's done, we're minimising your exposure, supporting you during the process to stay well. Now, many ceramic fillings that the dentists are using are called composite, and a lot of them can contain plastics like BPA. Now, they're hormone disruptors, and they can actually have an impact on your health and well-being as well. So are we swapping one dangerous product or potentially toxic product for another? Well, the good news is there are a lot of manufacturers of dental materials out there that understand the issue around BPA and hormone and endocrine disruption. And they produce BPA-free fillings, and they've been doing that for many, many years. And this is the type of material that I use in my holistic dental practice, and a lot of other holistic dentists use as well. Now, it is more expensive because of the manufacturing process and the materials that are involved, but it's worth it to know that that filling is not impacting on your health or producing any toxicity. So what we need to look at is that we've got to know what's in our fillings. We've got to ask questions. We've got to understand that just because a dentist is putting something in your tooth, it doesn't mean that it's safe or essentially good for you. The goal is to eliminate or drastically reduce the load that the body has to deal with to actually drop toxins out of the system. And we need to be really aware of that in the way that we're using our dental treatments and materials. That's why holistic dental offices will use metal-free materials to restore teeth, because they're least reactive with your body and your biochemistry. What you put in your body impacts and dictates on your health and well-being. And when it comes to dentistry, I believe you should be able to make an informed choice, ask questions, and understand what's going on, and have your dentist be open and honest and upfront about what they're using, what they're putting in, and what the possible side effects or consequences of that are. And if you've got amalgam fillings in your teeth, if they ever have to be drilled or worked upon, you have the right to ask that they be removed safely. And if your dentist doesn't understand what that is or offer that, then I would encourage you to look for one who does, just so that you get the best care and you're not going to end up with health problems later on that may come from those fillings and could have been avoided. So I'm glad that I've been able to share with this tonight. So thank you very much for joining me. I'm Dr. Rachel Hall of Evolved Dental Healing in Brisbane, Australia. If you'd like to know more about holistic dentistry or dental amalgam, then please feel free to look on our website at www.evolvedental.com.au, or you can hop over to my Facebook page and check out the articles and things there. You can ask questions, and that'll be part of upcoming Facebook Lives. Or if you're wanting to have a consultation about your dental health, your fillings, or anything that's going on with your mouth, then please feel free to give us a call on 37201811, or you can private message me or send us an email, info@evolvedental.com.au. So thank you very much for watching live. I hope that this has added some value and will start getting you thinking about your metal fillings and what's going on there. And if you have enjoyed it, please share, give us some hearts, make some comments. If you've got questions you'd like to ask me, leave them in the comments box. So what I'm going to say is, if you want to know whether you've got mercury fillings or not, after I've finished talking, go look in the bathroom mirror, and if you can see black, dark, shiny metal fillings, then you've probably got mercury. So thank you very much, Jodie, for sharing the video. I really appreciate that. Thanks for joining us, Deborah. If you didn't watch all of it or you missed the start, then feel free to watch the replay. That'll be posted both here on my personal page and over on Evolved Dental. So thank you very much for joining. Next week I'm going to be talking about fluoride and water fluoridation, and what my thoughts are around that, and whether it's a good or a bad thing for you, and whether it actually reduces dental decay. So thanks very much for joining. See you next time.